Hello friends, today we'll be discussing about electrosurgery diathermy, which is used in all surgical specialties. So before starting, I would like to thank Chandana Shri Ma'am for sharing the notes, which are very helpful for quick revision, which we'll be seeing in a little while. And the link for these notes and the Ma'am's notes is given in the description below. You can download it from there. It is available on the Telegram channel, that is Dr Lalkrishna MULWANI Tata. So without further delay, let's get started. So electrosurgery, it was started around in 100 years ago, around 1926, where it was first used, and it was done by Sir Cushing in a brain surgery. And the principle is where we use the high frequency electrical current to cut and coagulate tissue, and the different current and waveform determines the cutting and coagulation effect, and it is used for all open laparoscopic and endoscopic surgeries like TURP, etc. Application is hemostasis, control of bleeding through coagulation and cutting. And we have to use, before using, we have to understand the the way it works so that we can use it safely and effectively, and also to prevent accident and complications. And so it's a very important tool, diathermy electrosurgery for surgery, and proper technique and knowledge is important for patient safety. So now we see the principle. So there is, in diathermy, there is heat generation. How does this generate? When the electrical current passes through a conductor, it produces heat, and this heat is dependent on various factors like the current intensity, waveform, tissue property, electrode size, etc. Then we have various types of diathermy, that is monopolar diathermy, where we have a single active electrode and a large passive electrode, which is generally applied on the back or the leg region. So the concentrated current at the active electrode produces heat, and then it is widely dispersed at the passive electrodes, which minimizes the heat. Then we have diathermy, monopolar, then we have bipolar diathermy, which has two active electrodes and heat is generated only between the two active electrode tips. And how does this diathermy show its effect? That is coagulation, fulguration, and cutting. Where coagulation, it seals the blood vessels by dehydration and denaturation of protein. And fulguration, there is destructive coagulation along with charring. In cutting, it divides the tissue by vaporizing the cell water. So we'll see it in detail. So coagulation, here the heat induced cell death via dehydration and protein denaturation, which is achieved by blood vessel distortion, plasma protein coagulation, tissue desiccation, and clotting mechanism activation. Here we avoid boiling temperature to prevent cutting. Now we see cutting, where we have sufficient heat to vaporize the cell water, and here it uses continuous waveform and monopolar diathermy. So we see that cutting is through monopolar diathermy. It is not possible to bipolar. Short electrode tissue distance creates sparks for high temperature, which is used in cutting. Then fulguration, which is coagulation mode with high voltage, causes tissue charring and carbonization, that is blackening. Voltage and power can be adjusted for combined cutting and coagulation, that is blended current. So this was the techniques of effect, that is coagulation, cutting, and fulguration. Now we will be seeing some complications of diathermy. So electrical safety, that is electrocution, which is rare nowadays, but we should know and what are the possibilities, and we should go for regular servicing and checking of the safety of the instrument. Then fire risk, as we see that explosions can occur and spark can cause fire in case of flammable gases or liquids. So we should avoid and clean properly the alcohol based skin preparation and use proper caution near potential chances of fire. Then burns, that is due to proper contact of the electrodes, and that can result in burns. So adequate contact area and proper placement of the passive electrode. And patient grounding burn, that can be due to contact with metal objects. So we have to prevent patient contact with metal objects to avoid current pathway. Then insulation failure. So if there is some damage to the leads or the cable, there could result in insulation failure burns. And accidental activation burns, that is inadvertent activation of a diathermy electrode, that can cause accidental burns. And tissue damage, apart from the need, that could be a possibility, like channeling, where the heat generated in narrow tissue can cause tissue damage. So we have to consider both bipolar diathermy for such areas. For example, the circumcision in the penile region, where it can cause coagulation injury in the penis, or coagulation of spermatic cord in testicular surgery. So in testicular surgery, that could result in coagulation of the spermatic cord. So this is some complication, that is tissue injury. Then we have pacemaker interference. Pacemaker dysfunction can occur since the diathermy can interfere with the pacemaker, and we have to use magnet to deactivate the pacemaker if needed. Then some laparoscopic complication associated with diathermy, that is incorrect tissue diathermy, where due to improper visualization and unable to identify proper structure, can result in incorrect tissue injury. Insulation failure due to damaged instruments. Intraperitoneal burns due to contact between diathermy and metal instrument. Accidental activation, that is possibility. Thermal injury due to contact time with the tissues. So you have to minimize the contact time of the diathermy with tissue. Then we have capacitance coupling, where due to causes of capacitance between the instrument and the ports, it can cause injury. So here we have to try to use plastic ports, and we have to avoid metal ports with plastic cuffs, and always try to inspect, check, and uh, be cautious for instrument for their damage, so that this injury can be avoided. In capacitance coupling, there forms a capacitance between the instrument, the port, and the insulated part of the instrument. So it causes injury. Other consideration which we have to keep in mind, that is flammable anesthetics to be used with caution, patient positioning so that there is less chance of burn, emergency procedure, and there should be some fire extinguisher in case of emergency. So this was all about basics of electrosurgery. Now we'll see some more details of electrosurgery. So in electrosurgery, the effect is, as we have seen, the coagulation, cutting, and fulguration. But apart from that, that is the thermal effects. Apart from that, we also have one more effect, that is compression, where compression decreases the tissue volume and water content and causes apposition of tissue. This helps in further cutting and coagulation of the vessels. And thermal effects, as we have seen, the three: coagulation, cutting, and fulguration. So various methods which we have is the electromagnetic energy, liquid gases, and mechanical energy. So electromagnetic energy is the electrosurgery, the diathermy which we have seen, others like laser, microwave, radio frequency, and argon beam coagulation. These are some of the electromagnetic ways of energy. Then we have the liquid gases which can be sometimes used, like the liquid carbon dioxide and nitric oxide. Then mechanical energy, that is the ultrasonic devices, and high velocity hydro dissection. These are some of the ways which thermal effects can be seen. Sorry for the glitch, sorry for the disturbance. So the thermal effect of tissue. So tissue responds in a reproducible manner due to heat. So at 40 degree, there is irreversible tissue damage starts. At 50 to 80 degree, the protein denaturation and collagen breakdown starts. 80 to 100 degree Celsius, there is total desiccation. At 100 degrees, it is vaporization, 150 degree carbonization, and 200 degree fulguration. So as we have seen, the electrosurgery, monopolar and bipolar, these are ways of heat producing electrosurgical techniques, and they can achieve up to 400 degrees Celsius. Whereas laser can achieve up to 200 degrees Celsius, ultrasonic devices can achieve up to 80 degrees Celsius of heat. Then hypothermia, even that causes tissue damage and what we say, injury. So just a glimpse of it, where we see that at minus 40 degree tissue freeze and thawing causes vascular endothelial damage and cell membrane dysfunction. And at 195 degrees Celsius, less than 195 degrees Celsius, that is intracellular and extracellular ice formation happens, cell dehydration, shrinkage, and thawing causes osmotic damage. Now some more detail about electrosurgery, where they have the alternating radio frequency current of frequency 0.522 megahertz and causes ionization and heat. And there's a difference between electrocautery and electrosurgery, where electricity is used to heat a metal object and then contact with tissue, it creates heat. And in electrosurgery, the electric current flows through the tissue and heat is tissue is heated through ionization, and this causes effects. So here the current passes through the tissue and causes the damage. Here the current heats the metal object and that causes the tissue damage. So electric currents, there can be DC current, AC current, and pulsed current, where pulse current is used for electromyography and nerve stimulation, AC current in electrosurgery, and DC current in endothermy and acupuncture. And electrical resistance in tissue is inversely proportional to water content. So we have to understand that the desiccated tissue is non-conductive. It will not help in further causing cutting and coagulation. Most conductive tissue in decreasing order is blood, nerve, muscle, adipose, and bone. Density of current is inversely proportional to contact area. So higher with point than spatula. So spatula has more area. So than the what we say hook. So density is inversely proportional to contact area. So there is less density in spatula and more density in hook. So as we have seen monopolar, where as we can see in the diagram, the passive electrodes completes the circuit, and in monopolar the passive electrodes completes the circuit, and in bipolar there will be two blades. One will be acting as the inflow and other will be acting as the outflow. So the damage will be between the two blades of the instrument. Action is, as you have seen, cutting, coagulation, and desiccation. And fulguration, complication, as you have seen, that is grounding failure, alternate site injury, demodulated current causing muscle fasciculation and cardiac issue, distal site injury causing like GB dissection causing duct injury, sparkling, direct coupling, that is insulation failure, capacitive coupling, explosion. Then we have bipolar, that is the added aspect of the electrosurgery, where it eliminates the chance of grounding failure, alternate site injury, capacitance coupling, and insulation failure. So these risks are eliminated. Direct coupling can occur if there is metal between the tips and lateral spread of current is decreased, so there is less injury in the surrounding tissue. Only issue here is bipolar, that it needs irrigation as the tissue sticks to the limbs of the electrode. Then we will see some more advanced devices, that is advanced bipolar, that is ligashore or NSEAL. It causes the damage through the compression and coagulation. It can seal up to 4 to 7 mm of vessels or tissue. The monopolar can seal up to 2 mm of vessels. Here, advanced bipolar can seal up to 4 mm to 7 mm of vessel. So, electrosurgery, we have to consider that it is a risk for patients who have implants and pacemakers. So, we have to consider and have that protection for them, as we have discussed, like we use magnets in case of pacemakers. Then ultrasonic energy, where the electrical energy is converted to vibrations of around 20,000 hertz, causing tissue effects, that is cutting, coagulation, and drilling, even back scoring and cavitation, which we'll see in detail in some time. So advantages is here we have less heat generation, as we have seen it is around 80 degrees Celsius. So less tissue injury, less charring, less desiccation, less risk of shock, rather no risk of shock. It can seal up to vessels of 5 mm, that is 3 to 5 mm, blades through 2 mm and shear 5 mm. So here there is less chance of post-op adhesion and skin incision is superior in ultrasonic devices. That is the harmonic, as we have known. Disadvantage is aerosolized fat droplet when can interfere with visualization. So it can affect the assessment of tissue. Slower coagulation, so it is time consuming. Blade fatigue after prolonged use, so we have to wait for some time. Not reliable for large vessel, as we know that can seal up to 3 to 5 mm of vessel. Then for cavitational ultrasound, we have special, that is CUSA, that is cavitational ultrasonic aspirator for liver surgery and neurosurgery. Here it uses a low power ultrasonic dissector for the purpose. Then high power dissection, that is frictional heating. It can cause cutting and coagulation, that is the harmonic scalpel. It is used in both open and lap surgery. So high power dissection through the harmonic scalpel through frictional heating, causing cutting and coagulation. Then some points about lasers. What we have, the CO2 laser, ND-YAG, argon pumped dye laser, holmium YAG laser, excimer laser, KTP YAG laser. KTP's full form is potassium titanium phosphate, titanial phosphate. We'll see laser in detail in another video, but for now we'll be discussing this much and some more details about the recent advanced energy devices. So this I have taken from the Bailey, which is some added points which I would like to discuss. So as we have seen the details, some more detail I would like to add. So bipolar electrosurgical devices like the ligashore. So bipolar electrosurgery devices which can be used in open and laparoscopic surgery. They fuse the vessel wall to create permanent seal, and it can withstand 3 times normal systolic pressure. So it is more safer and effective than the ligashore system, that is the Medtronic. It uses body's own collagen and elastin to seal and divide the tissue, and it also reduces instrument handling during laparoscopic surgery, which is helpful. There is special feedback sensing technology for precise energy delivery, and there is automatic shutdown of energy when the seal is complete. So this is very important, that is feedback sensing technology, which is available in this bipolar electrosurgery ligashore. Then some key features of it are that there is real-time impedance monitoring and energy adjustment. So it is more conservative, seals vessels up to 7 mm in 2 to 4 seconds. We have to consider that it is slightly time consuming. It has consistent control and predictable effect on tissues, less desiccation as compared to other technologies. Then LigaSure Advanced through the Medtronics. It is designed for dissection, sealing and division in a single instrument, reduces multiple instrument during the surgery, so it saves time. So this is the added advantage. Now we see the harmonic scalpel, as we have seen in detail that it is the ultrasound energy from 20,000 to 50,000. As we have seen, it seals via the protein denaturation, which we have seen. Added advantage that it gives a precise cutting through the thickened scar tissue. So it gives a more defined cut. There's less smoke, so better visibility, takes longer time to cut, so it is slightly time consuming. It can only coagulate as it cuts, unlike diathermy. So it cannot just coagulate, it will cut during the coagulation. Benefit is less swelling and bleeding, so better recovery. Lower temperature in sealing, causing less tissue damage, less thermal damage, less charring and desiccation, as we have seen. Reduce operative time and enhance recovery. So reduced operative time is controversial, that in comparison to some of the other techniques, but it takes more energy at time in comparison to the electrocautery, that is the dipolar or monopolar. Now the combination devices, which are the special advanced ones, that is the Thunderbird S, which combines the electrosurgery and the harmonic, that is bipolar and the harmonic together, uses ultrasonic vibration and bipolar diathermy, can seal vessels up to 7 mm, and it also has a feature of seal only mode where bipolar diathermy is used only. Key points which we can understand, that is we have to have proper training to avoid complication, and there are various varieties available with various feature, and at last it can divide and seal vessels up to 7 mm. So this was all about the advanced energy devices. Hope it has been understood in short and can be used for exam purposes. And thank you for watching. Keep studying, keep growing, and please like, share and subscribe, and never give up, because great things take time. Thank you for watching. See you in next video. Thank you.